worry, I'm not taking any new patients today. I'm expecting a very special individual for a very special checkup. Someone tall, dark, and mysterious. Do you know anyone who looks like that? I'm just teasing, But thank you for making it on time. What can I say? You're oh so fun to tease, little guinea pig. Now, let me make sure I have this correct. You're here for a general wellness exam / checkup. I'm surprised. Normally you come to see me for any number of issues that you keep very hush-hush. I'm not used to you coming in on a scheduled visit for something so mundane. Are you sure you don't want to go to your general practitioner? You trust yourself with me? Are you sure? You're not scared of me, are you? I can do any number of things to you here, seeing as you're my last patient. There I go again, teasing. I'm just kidding. Okay, so checkup. Are you aware that we're going to be checking your mouth, your hearing, your eyesight, checking your height and your muscle mass, correct? Good. While I have you here, why don't you be a dear and step on that right here? Yes, that scary looking little device. It's not going to bite. It's probably one of the more advanced things I have here in this office. It's not very well stocked. All you're going to do is place your hands on that sensor. Yeah. It's not going to hurt. And you're just going to leave it there for a few moments. And it's going to get a reading on your bone density and your muscle mass. Like I'm going to ask for your weight. That's rude. No, I just want to make sure that everything is functioning properly. And something that a lot of doctors don't take into account is every body is different based on genetics, lifestyle, eating habits, of which I know yours quite well at this point, don't I? And just going to be a few moments. Oh, was that too corny? I know, I'm terrible. Again, my bedside table manners leave a little bit to be desired. I'm just waiting for it to be done. You're doing wonderful, little guinea pig. I'm just filling out the rest of your chart. I already know way too much about you, don't I? Like your blood type, and your eating habits, and your sleeping habits. I don't always have to talk to you, do I? Sometimes I'm good at my job, which, by the way, don't tell people about. I'm getting more and more clients as I go, and I was enjoying my free time, little guinea pig, to work on my own things. All the silence making you uncomfortable? Good. I'm almost done. So should that. It's done. You can step off. Let me take a look and see what it says. Everything looks good. That's a very good sign. Now, next, we're going to be taking your height, okay? Don't worry, it should be painless. And if I need a step stool, I'll go grab one. Again, that was the most advanced thing I have here in my office. Fun for me. And it's the reason why I don't want more clients. Having to do this for every person who walks through my door seems very bothersome, don't you agree? You're funny. Oh, wait, right there. I'm gonna go get a measuring tape. Yes, very old school. Thanks for reminding me. Okay. Now, stand up straight. Very, very straight. I think I'm gonna eat this whole thing. You're quite tall. Taller than me, at least. It's not saying a lot. Alright. Now, stand up straight. Is that the best you can do, little guinea pig? I don't know, I was expecting something more. Do I have to do everything for you? Don't worry, I'll help you. Just because I don't want you to feel embarrassed by your height. I want the best, most accurate reading. Alright, so stand up straight. Shoulders back. Back, 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 back. Perfect. Keep your neck straight, level. Tilt your chin up just a little bit. Just a little bit. And suck it in, hold your breath. Back straight. Really allow air to fill your lungs and your chest. Have it expand. Perfect. Now hold. Just like that. Are you still holding? Good. What? I'm just trying to make sure I'm ready. I had to make sure you're ready. It's not that I enjoy watching you struggle. Alright. Straight, 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 straight. Okay. Almost done. Okay, you got me. I already have the reading. I just want to watch you. See how long you can hold your breath for. No, I'm sorry, that wasn't part of the test or anything. Call it, curiosity. What? I'd like to know everything about you. Especially because you're always so tight-lipped. I take what I can get. Next, we'll move on to a quick temperature check. And then we'll move on to the fun tests. You don't consider them fun? I'll have to finish rolling this up later. Let me go get my thermometer. Now be patient with me. You know it's a little wonky. Alright, are you ready, little guinea pig? Good. Just want to make sure that this works. Oh. Just a moment. Come on, you stupid thing. This is why you think I need more clients. To buy better equipment. That's sweet. But again, I only use this on living patients. Which I prefer them to be, well, you know. No, I didn't mean dead, silly. No. I just prefer to work metaphorically rather than on actual people. I like more of the science behind medicine rather than helping people, but it's working. Okay. Hold still for me. I want to make sure I get this done. Hold on. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Perfect. Normal. Thank you for being so patient. I just want to make sure I got that done before I decided to be on the fritz again. Fun. Now let me write all this down and then we'll move on to next tests, okay? Good. I appreciate your cooperation, guinea pig. Okay. Your height. By the way, it looks like you grew from last time I took it. Or it could just be proper posture. And temperature was good. Perfect. Okay. Now we're going to start by looking at your throat and your mouth, okay? Good. You ready? Perfect. Alrighty. Now just tilt your chin up for me. Tilt your chin up. Perfect. I'm going to feel along your throat to see if there's any swelling, okay? Good. And you haven't been feeling any issues, any sore throat, any straining while breathing or swallowing, correct? Perfect. Doesn't hurt to ask. Alright, okay. Just checking gently. I'm going to feel gently kind of behind your ears as well, okay? Does anything feel tender? No? Okay. Good, everything feels good. Now can you open your mouth for me? Nice and wide. Perfect. I'm just taking a quick look. Not expecting anything, seeing as you already told me you haven't been feeling bad. No allergies or anything. I know we're in the rainy season and that's not fun for anyone's allergies. Good. I don't see anything noticeable. Okay. Can you swallow for me? Okay. I'm gonna feel around to your throat as you do it. Okay. Good. All right. Go ahead and swallow. Good. And one more time. Perfect. Everything feels good. Well, that's first test down, and you passed with flying colors, guinea pig. Now next we can move on to dealer's choice. Would you prefer nose or would you prefer eyes? Nose. Okay. Now I'm going to put up some herbs to your face. Each one has a very distinct fragrance that you should be able to pick up pretty easily, okay? And you're just going to tell me either what you believe it is or even notes of the scent, okay? I'm not looking for an exact name or anything, but they should be pretty obvious. Just make sure everything is working properly. The nose is kind of connected to everything around your face. A lot more important than people give it credit for. Okay, you ready for your first one? Okay. Again, these should be very easy. And if you can't tell me what it is, just give me the notes of whatever you're smelling, okay? Good, okay. I could smell these from here. Alrighty. Why don't you go ahead and give that a sniff for me? Sweet. Good job. It's vanilla and rose. So good. Good job. Again, very good nose. But again, the notes should be relatively easy to pick up. Okay. You ready for the next one? Good. This one's even more fragrant. It smells very bright and fresh. Okay, you ready? Good. Okay. Go ahead and smell that for me. What is it? Mint. Good job. Told you it should be relatively easy. One more, if you'll permit me. Alright, last one. Let's see if you get it. This one is very earthy. Kind of florally. Kind of sleepy. You ready? Good, okay. Go ahead and smell this one for me. Nice big deep breath for me. That's right. Lavender. Very distinct scent. Doesn't make you feel tired. Well, I need you awake for just a little bit longer. Thanks for seeing me so late, by the way. Again, because of word of mouth, people seem to think I'm an actually good doctor. And I've been coming to my clinic more often than not. So I wasn't able to squeeze you in any earlier, guinea pig. Don't you miss those days when it was just you and I, all the time in the world? I mean, of course I do. Just wanted to see if you felt the same. I'll stop teasing, though I was being very honest. You ready for your eye test? Good. Be right back. You ready, guinea pig? Take off your glasses. No cheating. I already know you have terrible vision. But we want to make sure it hasn't gotten any worse, okay? Good. I'm watching you. There they are, those big, beautiful eyes of yours. Such a shame you're always hiding them. More for me, I guess. You ready? Good. Alrighty. We'll do it easy. We'll start with this line, okay? Can you see it all right? You don't have these memorized, do you? Good. Okay. What's this letter? F. Good. Next one. B. Good. Next one. H. Good. Okay, let's move on down. You ready? First letter. O. Good. Next one. L. Good. Next one. C. Perfect. What about this one right here? F or an E? Okay. No, you're doing wonderfully. Kinda. Let's move down. Can you tell me what this one is? A D or an O? Okay. Next one. That one. An H. Good. Okay. What about the next one? Think a J or an I? Alright. Next one. A B or an E, okay? Last one. Last one. An S, okay. Well, I would say your vision's probably on par as last time, still not great. But that's why you wear glasses, so stick to wearing them. You haven't noticed any unusual eye strain or seeing things that you were easily able to see but now are having a little bit harder of a time? A little bit of strain from light. Let me guess, from your phone you're always using to talk to with your little friends. Alright, well, maybe for the next few nights you turn off your phone and go straight to bed. And maybe, just maybe, have pleasant nightmares about a certain doctor that you know. Or not. It's just a suggestion from a medical professional. Ish. Well, I guess we'll say you passed this test. Are you ready for your last one? It's gonna be hearing. Very easy. And if you want, you can even close your eyes while doing it. All you have to tell me is whether or not you hear the beeps from the left or from the right, okay? You can do this by raising your hand or speaking, though a lot of people prefer the hands. They get a little uncomfortable when they can't hear themselves speak, which makes sense, though I do live to see you uncomfortable. Gonna do the hands? Okay. Good. Let me go get everything. You ready? We're just gonna plop these onto your head. Excuse me, I'm gonna do my best to be gentle. Make sure I don't snag any of your little hairs. Okay, you ready? Alright. Get those nice and snug. How does that feel? Does it feel okay? Good. Doesn't hurt. Wonderful. Alright. You ready? Good. Nod for me. Perfect. Alright. I'm just gonna poke this out. Okay, and good to go. Good. Perfect. Alrighty, you're done. Hopefully you don't mind that I was teasing you at the end. I couldn't help myself. You make the most delightful of faces. But good news is you passed all my tests with flying colors. I mean, I wouldn't expect any less from my very favorite guinea pig, now would I? That's why I picked you. Also because you were available. But now I feel something towards you. A special connection. A friend. And a nice test subject. Well, I would say that you are free to go if you'd like. Or you're more than welcome to stay around here. Or me? I'll probably stay up late in putting everything into my system. I'm planning some more terrible tests for you for next time. Next time it will not be this nice. Did I scare you away, little guinea pig? That's fine. You should probably head off to bed. I know you live around here. Make sure you get home safely. Do you need me to walk you? Oh, you're a big kid. Understand. You can do it yourself. Well, text me when you get home, and remember what I said. Turn off your phone and go to sleep. Your eyes and your mind and your body need rest. Good night. Don't let the door hit you on the way out.